A world-first study of Victoria's most vulnerable children in the care of the state has had dramatic results. A pilot program of what's called therapeutic care has found that giving neglected children specialised help, not just a roof over their head, makes a huge difference to their lives. It sounds like pretty obvious stuff, but the study provides hard evidence that most children living in the care of the state are in desperate need of more help. 730 Victoria obtained rare access inside a residential care home for this report.
Lou's going to make the cup of tea.
Do you want to make a bet on it?
Yeah.
Are you sure?
Yeah.
I still feel like I'm at home when I come here. Still feel like I'm part of the family.
2 years ago, Rebecca was 16 years old and stuck in a cycle that started when she was a little girl.
Running away from home, living on the streets for a while, foster care and residential care, then running away. I didn't feel at home at the residential care units, so there was always kids there like trying to steal your stuff, getting abusive. It wasn't even a good place to sleep at night, pretty much.
And you had to live there?
Yeah, so I was better off on the streets than in resi care at the time.
With a family life marred by drug abuse, her last so-called home before this one was in a government-run high-risk unit.
There was bars on the window, so I felt like you were in jail. I was constantly abusive, just constantly crying, suicide thoughts, it was full on.
Didn't want to go in.
But then Rebecca came here to a cutting-edge home for traumatised children.
I thought it was like another unit. I'm just going to get kicked out of here in 2 months because that was the maximum that I stayed at a unit, 2 months or a couple of days, couple of weeks. So I was like, oh yeah, there's no point actually getting used to it or getting attached to anybody. I'll stick to myself. No one's here to help me. But over time, I realised, they are here to help me.
Rebecca was one of 38 of Victoria's most vulnerable children whose lives were measured in a detailed 2-year study. The initial findings were shocking. Many children, while in government residential care, were found to have significant and persistent health issues. One child had been moved 45 times. Another young man was charged 227 times over 8 years while in the care of the state.
The measures of emotional and psychological health.
Doug Faircloth's study measured whether a model called therapeutic care could turn those children's lives around. Is it fair to say that this model is more about loving the children or
Yes.
really caring?
Yeah, it's about forming attachment and nurturing relationships.
Everyone's just back to normal.
The idea starts with simply having more staff.
In a mainstream residential care unit, there might be 4 adolescents with 1 carer at some points during the 24 hours, whereas here there is often 2 or 3, sometimes 4 adults in the house.
Therapeutic specialists like Gary Miller are at the heart of this program. He works with staff to form an individual plan for each child in their care.
And when you're faced with a 15-year-old, often they're displaying behaviour when they're upset that's very much younger. So they're 3 or 4 or 5. So I talk about that to the staff and they respond to that person as they are appearing at the time. So if a 3 or 4 or 5-year-old is getting upset, you wouldn't send them to their room. You'd bring them in closer to you, or you'd go with them and you'd help them calm down with you.
Paul Rigg worked closely with Rebecca.
She really, really stretched us, and to the point where I think at some stage we were just about broken. Gary, we were fairly close to the end, but without any shadow of a doubt, the extra resource of having a therapeutic specialist on site here 2 to 3 days a week is extremely important.
Me learning about myself actually opened my eyes and I've got a lot of potential. I can make it somewhere. I can do something with my life.
Virtually all the young people involved in the study showed big improvements in their physical and mental health, as well as a big drop in risk-taking and police involvement.
The changes were very dramatic. A dramatic reduction in adverse reactions or adverse responses, things that were unhelpful or perhaps dysfunctional, and an increase and quite dramatic increase in what we'd say are very good ratings, that is moving towards what you would expect in ordinary life. And those changes were consistent, every measure, right across the whole program.
Not surprisingly, the intensive level of care costs about $90,000 more per child each year. But Doug Faircloth says that's almost all recouped.
Because of reductions in things like involvement with the police, secure welfare, regularly changing placement, and the exit process. Those costs didn't occur in program. So those were about $65,000. So a good deal, about 2/3 was recovered in program. The rest will certainly be saved in the longer term. About 60% of young people leaving out of home care go into homelessness. The prison populations around Australia have a very high number of people who were previously in out of home care.
The report recommends this model is now the standard for residential care across the state.
I think the number one thing is I was filled with hope. This is for the first time going to provide real, genuine hope for everyone involved.
But not for every child. The study tracked a comparison group of 16 children in standard residential care. Their measured levels, including health, education and self-perception, remained terribly poor.
For young people in normal out-of-home care, they didn't experience those changes at all.
That's pretty sad, isn't it?
Yes, yes.
Rebecca left the care system last year. She's now studying community services at TAFE and has big plans for her future, like helping other young people.
We've all been through something, so we all need that support. That's why we're all here.
Well, the Department of Human Services says that over the next 4 years, the state government will pay for 100 more children to get therapeutic care, on top of 40 existing places in the pilot program. That means about 1/4 of children in residential care will get access to better treatment. But what's not clear is when or if the remaining 3/4 of children in residential care will get that higher level of help.